After evaluating Isaac, we found that he has very tight upper traps as well as scalenes, so it's restricting his lateral motion as well as his rotation of his neck. So we're going to use a few myofascial release techniques, trigger point therapy, and IESTM to loosen up his upper traps and his scalenes so we give him full range of motion. For the first technique to release his traps, I'm going to perform a myofascial release known as single hand technique. So I'm going to take one hand and lock down his traps, or I'm pinning it up top. Then I take the other hand and use a gliding motion to release the traps. So we're going to hold this until we feel a release or until the patient feels some pain and restriction alleviated. We'll glide down there. And this could be repeated until that tissue has released. So we'll do it a few more times. It's important to get feedback from the patient and make sure they're not experiencing any more pain than they're already having, or if it's feeling good, so you can ask them, how's it feeling? And continue on that until it releases. And that will help with his lateral side bending motion restrictness. Next, I'll be performing a trigger point technique. So we'll find trigger points in his scalenes and his upper traps. So you want to glide along that muscle, and you can feel a knot, or what we like to call a speed bump. So what this does is causes restrictions in the muscles and prevents full lengthening of the muscle, which actually weakens it as well. So they'll feel hyper-irritability in the muscle that causes a little tension and tensing in that area. So we'll glide along the muscle and look for that speed bump. Once we find one, we want to hold it for 12 seconds, and we'll keep on doing those 12-second reps until they release. And often the patient will feel a referred sensation, and so you want to make sure that you're consistently asking them how it feels and if you should ease the tension. How's that? Okay, so that's with the scalenes. You want to expose it and glide along the scalenes. With the upper traps, we can also come from behind here, palpate and glide, looking for those speed bumps. Once we find one, push down on it. You can typically feel the trigger point releasing, so it can go down, and they can feel since that relieved pain and decreased sensation in that. And this will loosen up the muscle and allow for more mobility. Next, we'll be using instrument-assisted soft tissue mobilization tools, and we want to make sure that we have some type of lotion to allow for easy gliding along tissues. We apply it to the patient. And you don't want too much lubrication. Okay. Next, we'll take our tools, and you want to make sure that you hold it at a 45-degree angle, not at a 90-degree angle, which causes severe pain. And you want to have the velvet edge down. So you want to have a downward angle of the velvet edge here. So you go along the tissue, and we'll do this to break up adhesions in that tissue and allow for more mobilization. And first, you want to start very lightly along the tissue to make sure you aren't overdoing the pressure. And by asking the patient, how are you doing, and getting feedback, you can increase your pressure. That's pretty good. So you don't want to do this to the point where you're bruising the patient. Some patients will bruise due to just easy bruising. Okay, now I'll be performing a thoracic manipulation. So we would assess for the thoracic restrictions, and we could do a spring test just to see how much mobilization we have in there. And with patients with hypermobility, we want to use a manipulation to loosen that up, alleviate pain, and allow for less restrictions. So what we want to do is adjust your table to where you can lock out your arms. You want to feel for the restricted area, and you want to go laterally and put your hypothenar eminence on one side, just lateral to the spinous process, and your thenar eminence of your other hand on the other side. Next, you'll release the slack or take up the slack by rotating your hands. You have the patient relax, take a deep breath in and out. You can have them take multiple deep breaths. You want to lock out your elbows. And you want to take up the restriction. You want to engage that barrier. Once you engage that barrier, apply a quick high velocity thrust. And that should alleviate pain and restriction in the thoracic spine of the patient. Okay, now we will be performing a cervical manipulation. So we'll do this with patients that are restricted in the range of motion of their C-spine, or if they're experiencing some pain with motions. So with the patient, you want your hands around their head in a comfortable position for the patient. You want to take them to the side of the pain, so lateral bend to the side of the pain. So let's say Isaac has a right-sided pain. We'll take him to the right side, and you want to take him all the way, side bending. Next, you'll rotate the head away from the pain, but keeping that lateral bend. So you want to rotate until that resistant barrier, and then you can ask the patient, do you feel like it's about to go? And that's when you know you're engaging that barrier. So I'll ask them, do you feel that? To the end range. Once you get to the end range, you apply a high velocity thrust. Some patients will cavitate and some won't. However, if they don't cavitate, it does not mean they're not mobilized.